All right, so today on the program, we're looking at Breastfeeding Week and the imperatives for nourishing our next generation. All right, so I'll be speaking with some women who are very experienced in this area. And of course, the essence of the World Breastfeeding Week. And joining me in the studio this morning, I have Dr. Bridget Fagbuji, who is a senior registrar with the Department of Paediatrics at the Lagos State University Teaching Hospital. Dr. Fagbuji, nice to have you in the building. Good morning.
Good morning. Thank you very much.
All right, you need to just, you need to get closer to that microphone. How was your journey here, by the way? I hope it was good.
It was smooth.
It was smooth.
Yeah.
All right, then. And joining her on the phone line this morning, I have an experienced nurse and midwife of several years standing. She's Mrs. Sola Aketi, who is the Director, Nursing Services with the Lagos State Ministry of Health. Madam, good morning.
Good morning, sir. And good morning, listener.
All right.
It's a pleasure to be here once again.
Right. Well, I know we've been doing this for several years, but let's just touch base with the essence, really, of the World Breastfeeding Week. Let me start first with Dr. Bridget in the building. Bridget, talk to me of what essence is the World Breastfeeding Week?
Oh, very, very important. Thank you very much for the opportunity to talk about breastfeeding this morning. Our theme for this year, for the Breastfeeding Week for this year, is prioritizing breastfeeding. And then we want to create sustainable support system for the women who are making the good choice to breastfeed their babies. Yes, so we want to ensure that the babies are well nourished, and while we are doing that, we are sustaining our environment and making sure that the future is, sustained and bright for the babies and also the mothers and the community in total.
Right. And Mrs. Aketi, what are the key benefits of breastfeeding for infants?
Oh, fantastic. A lot. Like Dr. rightly said, this breastfeeding week is usually in August. But with the first 7 days, August 1st to 7th, prioritizing to be the major focus. And this year, as she said, is themed prioritize breastfeeding, create sustainable support system. What are the benefits? Number one, breastfeeding is natural. It is not diluted in any form. So the children receive the natural means or normal value they're supposed to have. Two, it enhances bonding. It promotes love between that child and the mother. And as well, because psychologically, when you keep looking at your baby, when you are breastfeeding, you are concentrating on that baby, it fosters love. Thirdly, it makes the mother to feel fulfilled. When you see a breastfed woman, she knows, yes, I'm a mother. And if they did not express it on time, it can cause breast engorgement and other problems related. But for the opportunity to breastfeed, and but for it doesn't allow infection to the children. It's free of anything.
All right.
It's naturally given. And breastfeeding should be encouraged.
So it has a lot of benefits.
A lot.
Okay. All right. So Dr. Fagbuji, I'm just wondering why breastfeeding should be a source of conversation at this time. I mean, isn't it just natural that when a woman puts to bed, the most natural thing is for her to breastfeed her baby? Why are we talking about this?
Okay, really it's natural, but sometimes some women have some obstacles or, challenges with, starting breastfeeding and sustaining it. They don't have the support that they need. They have medical issues or, some of them are not very well informed, so they do not make the right choice, or they try to make the right choice, but they are not able to sustain it or succeed at it. So we are here to encourage women. We want to give information and let them know that it's possible and it's the best thing to do, actually. It's not every woman who is doing it. Statistics show that not more than half of the babies that we have actually have, the recommended amount of breastfeeding, which is exclusive breastfeeding. So we want to campaign that this should increase. We want to increase our percentage.
So if I'm going to put that in context, Mrs. Aketi, you are a midwife for several years. So if we have 10 women in the room right now who are put into bed, how many are likely to naturally breastfeed their children for 6 months?
Thank you so sincerely. It has been evidently known that people at the rural area, they comply with information. But people at the urban center is quite challenging. But like I can tell you, Lagos State is doing a lot. because statistically, low and medium income countries compared to high level, they tends to give breast milk depends on so many variations. Like in Lagos, about 51.4, 57.4.
Okay.
Early initiation is the best. And that's why when they're in the hospital, for those that deliver in the hospital, we ensure that we supervise that process. Some are new, like doctor said, and that will result in maternal mental challenge, maternal mental health, which is also another public health priority now. So all these young ones has to be encouraged. And so that 57.4 in Lagos is very, very vital, with about 14% of it being at early initiation. If they are not encouraged to do that, it will have an after effect after discharge. It will prevent their uterus to go through normal involution, that is reducing back to pre-pregnancy state, and that can cause a little challenge. Another thing is that in our status, as we believe, our people at the local end gives to breastfeeding because they knew the importance. But career women and the like, they see it as a medium of your breast will sag. There's nothing like that.
Is that not true?
There's nothing like sagging breast. So you have to ensure that you encourage them, because in advanced cases, people don't usually do.
So let's bring that debate up now, because I see Dr. Bridget is chuckling in the studios. So are you saying it's not true? I mean, if you're to expose if a woman is exposed her breast to constant breastfeeding of a child, wouldn't that lead to sagging?
No.
Dr. Bridget, talk to me.
Well, I think there are natural processes that occur with the breast development, and then, as the woman matures, whether or not she breastfeeds, these things would naturally happen physiologically. So I think if you breastfeed your baby, if you look at the benefits for the baby and for yourself, actually, when women are pregnant, for example, they add on some weight. Breastfeeding your baby adequately sometimes will help to reduce some of that fat, because you're going to use much of it, in nourishing the baby. So I think the benefits, actually, I know a lot of women who breastfeed their babies and who maintain very good figures.
You mean it?
Yes, I do.
Okay, so let's talk about the reasons why women might not be able to actualize or perhaps meet up to the ideals that you are talking about. 6 months exclusive, right?
Yes.
That's the ideal.
Yes.
But as we speak today, just like the figures which Mr. Aketi just gave, in Lagos, over 57%, the remaining 43%, there must be reasons why that is happening. Why do you think women, or what are the factors that could stop a woman from exclusive breastfeeding? Mr. Aketi, can you just let us in on this?
Thank you so very much. There have been so many challenges identified. That's why we continually say that early initiation, which with the support of healthcare workers, can easily be achieved. And that's why we are having this advocacy. I see this discussion as a good advocacy for our people, the generality of our people, that put your babies to breast, whether in the hospital or at home, anywhere. 6 weeks, you could see the government did fantastic job. You asked me for the I'll quickly say 6 weeks, 6 months to stay at home is to enable you breastfeed your baby effectively. Yeah, it's only Lagos that actualized that opportunity for its people. And not even that 10 days for men as paternity leave. It's fantastic. No other state does that except for Lagos State. Lagos State is doing a lot towards it to ensure that. And so what are the challenges? We find out that cultural practices and beliefs, what are they? That if you give your baby this, you should give him another food. No. No pre-lactic food. Because this particular food you are given to the baby, especially the colostrum, the first one that comes from the baby's breast, is the first milk, and it's very rich in nutrients and antibodies. So this meat of whatever is not. Another point is lack of support for the mothers. Majority of our mothers, even mother-in-law, they are career women. So they should be available for these children. I mean, for this new mom when they put to bed. And there are a lot of maternal employment, because we find out that most of our, if you don't work, you can't eat. Career progression, career pursuing. So you've got to let them have a crèche nearby where they have their whatever to enable them breastfeed their baby. Often they are not even wired to work.
What about poverty? What role is poverty playing in all of this?
Poverty is it cut across, but it depends on the level at which you mention it. I'm just mentioning we call it socio-economic factor. is encompassing, because if you say poverty, low poverty, insecurity, you could see in the far north, it's a educational challenges. There are also social economic factor, and poor access to health services can also impact on this breastfeeding. There are numerous.
Right.
So I need to let because of other persons.
Yeah. So, but when you look at it, a woman who is not well fed, will she be able to breastfeed her baby well, Dr. Bridget?
Well, the mother's nutrition is very essential to adequate breastfeeding. So, yes, if the mother is malnourished, it's not likely that she'll be able to breastfeed well, but it is still better, because in a situation where there's poverty and you opt for other sources of nutrition for the baby, we find that the babies end up being malnourished as well. So, we advocate that as much as, that's why we're calling on community efforts and government too. Mothers are better breastfeeders, so to say, if they are better nourished. Yeah, so I just want to add a little to what she has said. So for those women who are career women, who have career, being like a challenge to them, they want to breastfeed their babies, but they need to be at work. We can teach them how to express and, store breast milk so that their babies will still get breast milk.
Okay.
So the fact that you want to pursue career does not cancel the.
So how long does it stored breast milk? How long does it last? Really, will it not go sour? Will it not be dangerous for the baby's consumption?
Okay, so with proper sanitary conditions, you keep clean. You're able to keep breast milk on table without electricity, without refrigerating for about 5 to 8 hours, 3 to 8 hours actually. So say a minimum, an average of 5 hours or thereabouts. So if you are refrigerating it for some days, yes, up to some 3 days or so, and then if you want to freeze it, up to months.
Wow.
Yes. So just make sure that you keep clean, and there's everywhere you use clean utensils, and you keep to sanitization.
Right. All right. So, Nurse Aketi, what roles can men play in all of this? Because a lot of times there's always the argument, who owns the breast?
Roles. Number one, let the men assist in early initiation. For instance, when they are coming to the antenatal, we do encourage them to ensure they clean the nipple in order to enhance free flow. And naturally, the moment you put to bed, there's a release from the brain for your breast milk to be well expressed. I can tell you, where it's not possible, men can as well help to suck it out, and the baby will find it, just to enable you to free flow. Again, men should be available for other things like support in order to maintain the mental status of this one. Once their mental status is maintained, they can maximally breastfeed the baby. What are those? Assist in household chores, assist in engaging yourself with them when they are breathing. Because this period is a very busy period. They carry the pregnancy for 9 months over labor, and now they are breastfeeding. They won't sleep in the night. They wake up as well. So those other things, men should be available for that. And 3, this is the time to ensure that you don't add to their mental status negatively. How? You don't shout at them. You pet them. Women are wonderful. Once you pet them, you give them the adequate care, they come out brightly. And not even that, when they are going to see the physician on appointment, create an opportunity either to drop them or create someone that will take them to school, because them to the hospital, because this is the time everybody, we need to bring something to the table. But while they are going through this process, men should give them optimal support.
All right, Dr. Fagbuji, there's always the challenge sometimes when the baby is born. For some ladies, the breast milk doesn't flow. I mean, the milk refuses to flow. And you have a baby there. We say we want to adhere to exclusive breastfeeding. The baby is crying, and people are a bit scared. What do? We need to give this baby water or something. So at that stage, what should one do?
Okay, so in my own experience, most of the time when women say, I'm not lactating, it's really not the case. So somebody needs to encourage them and just show them. Sometimes we'll express the milk and they actually see it flow. You see their faces, lit up when they see the milk coming out of their breast. They don't know that there's actually breast milk there. Sometimes, because initially in the first few days after delivery, what comes out is colostrum. It's not a lot, but it contains the right amount of nutrient and nourishment that the baby needs.
So what do they do at that point? I mean, how can people help them, or what happens?
Just encourage the mother. She needs to take more fluid. She needs to take more fluid. She needs to, have been a good mental state. She needs to be.
We have 1 hour, 2 hours, 3 hours gone. The baby has not tasted anything.
No, if you put the baby to breast and the baby sucks on the breast, there is something coming out. That's what I said. That's the colostrum. It's coming out. It's there. Sometimes we need to just show the mother that, okay, we express and we let her see that there's actually something coming out. It doesn't flow the way it might flow later during the care of the baby, maybe some weeks or months down the line. It's not pouring out like, the tap that some women want to see.
Right.
But there is milk there. Sometimes you just need to show the woman, demonstrate to her that there is milk there. It's just colostrum. It's not a lot, but it's sufficient for the baby.
Right.
Yes.
Okay.
But I must add here that in some situations, there might be absolute reason why the mother is not able to breastfeed.
That's right.
Yes.
I mean, some health reasons.
Yes, some health reasons.
So in those kind of conditions, what happens?
Also, in those situations, there are other options. We usually would use maybe breast milk substitutes, formulas. We can use that.
Right.
In some climes, they employ wet nurses. You can use stored, human milk to feed the baby.
To feed the baby.
Yes, but commonly we use formula.
Ms. Aketi, is it possible for us to have community breast support? Is there anything like that?
Seriously, before then, like Dr. rightly said, there are some debilitated situations whereby following the delivery, the woman going to another whatever. So long challenges or in terms of our health. So it's better you look for opportunity. But all the same, they need to consult their physician who will advise better. But before then, you encourage them on proper nutrition. Balanced diet does not necessarily mean to be a very expensive diet.
Okay.
Something good that can enhance. I tell you, I used to encourage take plenty of jute. That's a way to.
Okay.
Plenty of jute is iron, and to help you in transfer because iron is what they needed, and some other things that when they come to mothercraft, we do teach them that. But before that, I have said it before, when they are and during antenatal, before delivery, you continually tell them how to clean the nipple. Rub that nipple with olive oil. In the morning, wash it with water and remove the crust. If the crust if that practice is not performed as expected during pregnancy, it will cause the delay. Another thing is that you should, like I said, relaxation. Give them some relaxation medium through which the man should not contribute, because the moment the woman whatever light is triggered, I mean, she's in that mental status and she will not be able to optimally breastfeed. Again, you can pump. We don't encourage it, but if that is at the extreme cases, you can pump. Regular pumping can help to stimulate milk production. All in the name of, by the time you are pumping, you are sending the message to the cerebral that this thing should come out as expected.
Okay, let's begin to round off.
Early registration is very, very vital.
Right.
Yeah.
Let's begin to round off now. But I have some messages here. This one says, "Good morning, ma. I'm a new mom and my baby just refuses to." Okay, it says, "I'm a new mom and my baby just refuses to latch properly. Is this something I'm doing wrong?" Diola from Beja is sending that one in.
Thank you very much. Community-wise, we are telling you people as a young mom, attend mothercraft. Find it, because when you are well informed, you know what to do. There's a position you should adopt when you are breastfeeding this child to prevent strain on your own neck and your back. Likewise, the baby to be. Some people they put breast on the baby and close the nostril. These are the practical things you need to learn as a young mom. We might not be able to reach everybody, but when you come to where mothercraft is being done, as in antenatal care or infant care,
right,
for immunization, for whatever, they will teach and ask questions. All
right, just one more before we round up. Just one more. This one says, can exclusive breastfeeding really be enough for the first 6 months, even without water? Thanks, Lydia is sending that one in. Is it possible, Doctor?
Oh, yes.
Doctor, can you say something?
Yes, thank you very much, ma. Yes, exclusive breastfeeding is sufficient for the baby for the first 6 months. A lot of times, mothers don't do it right. The baby is crying, and then they just imagine that the baby needs something else. They don't realize that the baby needs...
Fagbuji, the babies of these days, I hear they're so hungry.
so the mothers are also capable. You breastfeed your baby.
The more you breastfeed,
you follow your baby's cues. You breastfeed the baby on demand.
Okay.
Most babies do well. Babies do well with exclusive breastfeeding.
All right. So, madam, as we round up, you said mothercraft. Where is that? Where does it hold?
When I say mothercraft, I'm talking of all these welfare, children welfare clinic.
Okay.
Pre that is the antenatal clinic. And when
Alright.
you attend this and a midwife or a pediatric nurse is in attendance, you get value for whatever. May I suggest that women should not prioritize their economic needs in terms of career at the expense of these children. This generation is different, like you said, right from womb, they're already sucking their hand.
Okay.
So, if I may say,
that means they're very hungry. All right, there's a message as random. This was a good morning. I am Sola. I just gave birth to twins, but I'm not producing enough breast milk. They have been on formula. They have been feeding on formula, and I'm worried. What can I do? That's a very big one, doctor. For someone who who gives birth to twins. Hello, we can hear you, madam.
Yeah, I said this is a practical session. Twin pregnancy is another burden. I thank God for First Lady of Lagos State. She initiated something, Jumeji law. She understands that when you have these children, one is a problem. Two, they are already extra.
Right.
And if they have a toddler before then, it's another complicated. So, what do we do? The breast milk is not enough for the two of them. Try to tell them to augment.
Okay, and how do they augment?
We encourage them to augment. But before then, she must have tried and exclusively keep, because the more you pump, the more the milk. She should pump beyond her, but just in case that pumping is telling on her, because breast milk is another exercise on its own. And that's why you see women that are breastfeeding, they lose weight. It's another medium, they lose weight, apart from the fact that they don't sleep well in managing these children. So, our opinion say that they can augment, but they should see their pediatrician.
We'll leave it at that for now because of time constraints. Madam, it's nice having you connect with us. Thank you so much for linking up with us this morning.
My pleasure, sir.
And for Dr. Bridget Fagbuji, it's a thing of joy to have you here. Thank you so much for being here.
Thank you very much.
All right, so we've been able to reflect a bit on World Breastfeeding Week, which is from the 1st to the 7th of August. Endeavor to ensure that we encourage women to breastfeed their children properly, and we have a more nourished next generation. A brief break. When we return, we'll switch gears to Maritime Today.